Hi there, Dr. Yang from Pancreatic and Biliary Surgery. In this lecture, we will talk about disease of appendix. The contents include anatomy of appendix, blood supply, acute appendicitis, and appendectomy. First, we will talk about anatomy of appendix. The base of the appendix can be anywhere. It is located at the tinea colli of their convolutions of the cecum. And the tip of the appendix can be located anywhere in the right lower quadrant of the abdomen, pelvis, or retroperitoneum. In the adult, the average length of appendix is 6 to 9 centimeters. However, it can be vary in length from less than 1 centimeter to over 30 centimeters. The outer diameter varies between 3 to 8 millimeter, while the luminal diameter varies between 1 and 3 millimeter. The blood supply. The appendix receives its arterial supply from a appendicular branch of ileocholic artery. This artery originates posterior to the terminal of ileum, entering the mesoappendix close to the base of the appendix. It's now well recognized that the appendix is an immunology organ that actively participates in the secretion of immunoglobulin, particularly IgA. We will talk about acute appendicitis. We will talk about the etiology. The etiology and the pathogenesis of appendicitis are not completely understood. While obstruction of the lumen due to phygolith or hypertrophy of lymphoid tissue is proposed as the main etiology factor in acute appendicitis, the frequency of obstruction rises with severity of inflammatory process. While phygolith and calculi are found in about 40% of the cases of simple acute appendicitis, while about 2/3 of the cases of gangrenous cases without rupture, and nearly 90% of the cases with gangrenous appendicitis. The proximal obstruction of appendiceal lumen produces a closed-loop obstruction, and the mucosa rapidly produce distension. Distension of the appendix stimulates the nerve and producing vague, dual, diffuse pain in the mid-abdomen or lower epigastrium. Distension increases, and rapid multiplication of bacteria. These cause reflex nausea, vomiting, and visceral pain increases. As pressure in the organ increases, venous pressure is exceeded. The mucosa of the appendix is impaired of blood supply. The integrity is compromised early in the process, which allows bacterial invasion. As distension, bacterial invasion, compromise of vascular supply, the infection progresses and perforation occurs. A symptom of acute appendicitis. Appendicitis usually starts with epigastric region or peri-umbilical area and diffuse pain that eventually localized in the right lower quadrant. Usually we call that shifting right lower quadrant pain. The signs and symptoms of acute appendicitis. First, pain or migration pain, pain progression, source sign, direct or indirect tenderness, rebound tenderness, percussion tenderness, or even guarding or rigidity. Then fever. Some patients also have GI dysfunction like anorexia, nausea, vomiting, or diarrhea. Well, in a lab examination, the white blood cell may increase because that leukocytosis, and the C-reactive protein level increases. While the anatomic variations in the position of inflamed appendix lead to deviation in the urophysical findings. For the ratio appendix, the abdominal findings are less striking, and the tenderness may be most marked in the flank. Well, for the hands into the pelvis, the pelvic appendix, the abdominal findings may be entirely absent, and the diagnosis may be missed. While for some patients, the right-sided rectal tenderness may appear. Others, like South signs. Pain with extension of the right leg indicates a focus of irritation in the proximity of the right psoas muscle. And the obturator sign. Stretching of the obturator internus through internal rotation suggests inflammation near the muscle. Well, McBurney's point. The pain at McBurney's point. The McBurney point is 1/3 of the distance from anterior superior iliac spine to the umbilicus. Well, classification of acute appendicitis. It can be divided into acute simple appendicitis and purulent, gangrenous perforated appendicitis, or even periappendiceal abscess. Lab findings. It's unusual for the uncomplicated case with white blood cell over 18. While if the counts above this level, that usually means a perforated appendix with or without abscess. While the CRP, the C-reactive protein concentration, is a strong indicator of appendicitis, especially for the complicated case. But for some cases, white blood cell counts may be low due to lymphopenia or septic reaction. But usually, in this situation, the proportion of neutrophils is really very high.